The last thing we want to do is go from a Democrat health care system to a Republican health care system. Our goal would be to go from what we see as a Democrat health care system to an American health care system that recognizes the needs of all. One of the important things that we need to convey to the American people is that nobody's interested in pulling the rug out from under anybody. We believe that it's absolutely imperative that individuals that have health coverage be able to keep health coverage and move, hopefully, to greater choices and opportunities for them to gain the kind of coverage that they want for themselves and for their families.
Is the president-elect, Mr. Trump, going to keep his word to the American people and not cut Social Security, Medicare, and Medicaid, or did he lie to the American people?
I haven't had extensive discussions with him about the comments that he made, but I have no reason to believe that he's changed his position. I look forward to working with you to make certain that every single American has access to the highest quality care and coverage that is possible.
Has access to does not mean that they are guaranteed health care. I have access to buying a $10 million home. I don't have the money to do that.
And that's why we believe it's appropriate to put in place a system that gives every person the financial feasibility to be able to purchase the coverage that they want for themselves and for their family. Again, not what the government forces them to buy.
Yep.
How do you square reaping personal financial gain from the sales of an addictive product that kills millions of Americans every decade with also voting against measures to reduce the death toll inflicted by tobacco?
Well, it's an interesting question, Senator, and it's a curious observation. I have no idea what stocks I held in the 90s or the 2000s or even now. All of these decisions for all of us, I suspect, are through mutual funds and through pension plans. I would bet, and I don't want, well, I ought not bet here. I would suspect that in your pension plan, that there are components of that are held that may have something to do in some time in your history with tobacco. So
I find it very hard to believe